Thank you, Mr. Chair, and I thank Dr. Friedrichs for testifying before the Select Subcommittee today. And Dr. Friedrichs, as you note in your written testimony, Congress established the Office of Pandemic Preparedness and Response Policy, OPPR, and this was in the latter part of 2022, to lead and coordinate actions related to preparedness for and response to known and unknown biologic threats or pathogens that could lead to a pandemic or significant public health-related disruptions in the United States. And actually, to follow up on my colleague's question, a similar question, but perhaps not in the same manner. And that is, I'm an ophthalmologist. I was also a former director of the Iowa Department of Public Health. And as an ophthalmologist, let me just say, hindsight is 20/20. And so that is, we certainly know that there were challenges during COVID for a variety of reasons. It required a government-wide response, especially from our healthcare agencies and from our CDC and our state and local public health agencies. Given that OPPR was established after the worst of the pandemic, I have some questions about what lessons we learned from the government's response to COVID-19, and I specifically asked this because I've met with CDC and the new director, and we still haven't acknowledged mistakes like the CDC's failure to, to develop a test in a timely fashion, or to utilize our research laboratories, our private university laboratories to help with that, to reopen schools in a timely fashion, especially given that overseas evidence had already shown that there was not a problem with children. We knew early on in the pandemic that the Chinese Communist Party, one of the truthful things they said was that there's not a concern among children, especially elementary school-age children, about risk-benefit for COVID-19 vaccines, myocarditis and pericarditis in young people, mandatory vaccines, and what that's done to increase vaccine hesitancy. I could go on and on with the mistakes that still have not been acknowledged and accurate reporting of adverse outcomes. So how will you ensure that the efforts made by OPPR, and this is my concern, will not be duplicated by other agencies, such as the CDC, or ASPR, or the FDA, or the NIH, or HHS? All of these agencies have input. How do you coordinate with each respective agency? And I understand that you also work more with industry, which I think is important. What are powers and authorities? Who's going to be the messenger? Who is going to speak? Is that ASPR? Is that CDC? Is that someone who's appointed by whoever the president happens to be when we have our next pandemic? Can you contract? And can you order other agencies to gather certain information?
Congresswoman, thank you. And you laid out a number of things, so I'll hopefully address all of them as I go forward. Some of the easy ones to answer very briefly. We do not have contracting authority, nor do we have the funds to do that, so we will not be a contracting agency competing with ASPR. We don't perform bench research, so we will not be competing with the NIH. We are not the public health experts, that's CDC, and we will not be competing with CDC. What we are the conveners that bring all of those groups together, as well as the leaders of the national labs in the Department of Energy and the labs in the Department of Defense, and the people who are working on contracting in DOD and DHS and VA and other federal agencies. So regardless of the topic that you described, what we bring to the discussion is the ability to convene and to integrate efforts across departments and agencies, not to duplicate, but to identify where there's opportunities to better synchronize and integrate what we're doing across the whole of government and with our state, local, tribal, and territorial partners, industry partners, academic partners, and others who share our commitment to mitigating risk.
So then that brings up a very simple question. So in public health, we're used to convening. It's one of the things that we do and do very well. So if COVID-19, well, I'll just say in the next pandemic, because we know that there will be another one, which agency do you think is best fit to handle the response? Because I think that having another agency in the White House can lead to confusing messages to the public.
Congresswoman, thank you for sharing that concern. And I'll go back to the painfully learned lessons after Katrina that led to the development of the National Response Framework. What we learned and what we've continued to learn in multiple responses since Katrina is the value of a whole-of-government response that addresses all of the aspects of an event as it's occurring. And as several people have noted already, in the case of a biological event, there's educational impacts, there's industrial impacts, there's impacts on food supply. The entire society was affected by that. Our role as OPPR in the convening role that we play is not to duplicate what any individual department does, but to ensure that we leverage those best practices that our country has painfully garnered over the last nearly 20 years now, to ensure that we bring all of those voices to the table and that we provide the best advice possible based on all of those inputs.
Thank you. I yield back.